When skin changes are hormonal, what skincare realistically can help, especially during perimenopause, or is it individual to each patient?
Of course, it's very individual, but there are major, like the basic ingredients, I would say. So for me, basic ingredients, as mentioned several times so far, is sun protection. Another thing during perimenopause is picking the right type of moisturizer or not. So basically, some women who experience hyperseborrhea, so oily skin during that phase, you want to moisturize, but with very lightweight moisturizers, okay? On the other hand, patients who experience extreme sensitivity, dryness, they would need heavier moisturizers with ceramides, for example, that will hold the moisture better in their skin. So those are two ingredients I would say that we need to address most of the time with all the patients. Second is cleansers and exfoliation. So I just find that exfoliation is overdone. Toners are overdone. I know a lot of physicians do recommend having a cleanser and then a toner. I find that during this period of perimenopause and menopause, these items tend to be a little bit harsh on the skin, and the much needed sebum that you need during that phase is ripped off with these aggressive kind of ingredients. So using milder ingredients would be a better idea during this period of time. Of course, we're not talking about puberty or 20s when you actually might need those ingredients. Other ingredients are, of course, retinoids. Okay, so retinoids are very well known to have so many positive impacts on the skin, and there are many different types of retinoids. So I always, because initially
what
they
do
can
they
be,
do? What do retinoids do?
Retinoids help with everything. They help with, we give them to teenagers to reduce the appearance of comedones or blackheads and whiteheads, so they can treat the different stages of acne. Retinoids can help to reverse DNA damage induced by the sun. They can organize how pigment is distributed in the skin. So we use them for melasma, for example. And they're anti-aging. So basically, they are known to slow down the breakdown of collagen that increases with time. So starting a retinoid in your 20s is probably the best idea. Okay. And there are different forms of retinoids or vitamin. They're also known as vitamin A derivatives that can be used. So the basic is tretinoin, which is known to be the most harsh. So it can cause, the side effects are known to be irritation, flakiness, redness, just unpleasant. But there's retinaldehyde, there's retinol, there's other forms of retinoids that could be more suitable for the sensitive skin type. And it's also about how they're used. So initially, patients who has never use a retinoid, I ask them to do what's called short contact treatment. So just exposing your skin 2 or 3 nights a week to the ingredient, removing it after an hour or two, putting a moisturizer, and then going to sleep. And this is a little in which you can expose your skin to this active ingredient, let it adapt over weeks. It could take months to adapt to a retinoid, and it eventually works very well. So retinoids are a very important ingredient that I would want all my patients to be using. Other ingredients include vitamin C, because we know it has anti-aging properties, it improves pigmentation, it has an antioxidant role to the base. So basically, it helps with reducing the reactive oxygen molecules that are created with UV sun exposure. And that's why I usually recommend that it's used in the morning before sunscreen. Okay. Other ingredients that are known to have hydrating properties in addition to anti-aging properties are alpha and beta hydroxy acids. But those can be quite irritating for a lot of patients. Again, there are the milder forms that might take a little bit longer to show their impact on the skin. Even if it takes longer, you're going to be using them forever anyways. So milder ingredients does not mean they're not as effective, they're just more convenient. So those are the 5 main ingredients. I have patients who love to have a routine and they love to have steps, like several steps in the morning, several steps in the evening. But I find that during the 30s and 40s, you have so much on your plate anyways, that I tend to want to really simplify the routine. Okay, so I would just recommend a serum and a sunscreen in the morning, a moisturizer and an active ingredient in the evening, and that's it. And it doesn't have to happen every night. So if you're coming back home from work, you have 2 or 3 kids to run after, and you're just dead tired by the end of the day, just cleanse your skin, put a moisturizer and sleep. Or just cleanse your skin and sleep.
Exactly. Yeah. And what if you have extra sensitive skin? For example, I have extra sensitive skin. Vitamin C doesn't necessarily work well with my skin.
Skip
or
it.
tretinoin or whatever.
Yeah. I would say prioritize. Okay, so prioritize one ingredient at a time. So I would want you probably to start with the retinoid because that's the most important ingredient. And I would recommend a mild one, okay, something with a low percentage of retinaldehyde or even a very, very low percent of retinol. And I would ask you, I would be happy if you're using it one night a week.
Oh, wow.
Yeah, so it could be one night a week for the next 30 years is definitely going to play a role. So if you can manage one night a week, it would be still a plus.
Good. No, it's good to know that because I know because like you said, a lot of us like routine. I personally like a routine, but I don't want to have a 10-step skincare routine. I think it's unnecessary.
The minority do. The majority wanted to be simplified.
So like 2 or 3 steps I'm fine with. Like you said, kids and just life in general.
Exactly.